Hello and welcome back to another one of my videos. My name is Kim. If you're new here, welcome. Thank you for joining. I hope you love my content and like, share, and subscribe and comment below. I will appreciate that in the gates. So today, as you see, the title is Supplies You Need for Nursing. For me, I am a hospice nurse. I am an LPN. I am continuing my education as an RN and I'm continuing to go back maybe for my master's. I'm not sure. Is let's get one thing done at a time, okay? All right. So today I just want to let you guys know I have been with hospice for a very long time. I started out as a CNA and I worked my way up and I'm continuing to work my way up. But when I became a nurse, I expected certain things from my job to supply me that it did not. It's no discredit to my job or anything like that. It was just that I was so anxious to become a nurse. I did start in a nursing home. You can check out that video as well. I started out in a nursing home because I ended up getting my license in Indiana before I got my license in Illinois. So I was so ready to become a nurse. I end up purchasing supplies for my job and things like that. And when you work in a nursing home, they do have equipment like blood pressure cuffs and um I don't well not really a stethoscope and things like that, but I'm sure it's one available. So yes it was available now that I think about it because they also had disposable stethoscopes as well. So but I ended up purchasing all my supplies from Amazon. So the things I ended up getting was a bag. I ended up getting a, a bag, and then my bag, I ended up, no, basically, I started out with uh, um, a book bag. I started out with a book bag. So, excuse me for my fumbles or whatever. So, I ended up starting out with a book bag and I ended up having a notepad. If you see me look down, because I wrote everything down on my little notepad. So I ended up getting a notebook, sticky notes, markers, pens, a pencil. Make sure I had an eraser. Um, but the nursing home had computers versus my hospice job does not work on computers. They've been out of computers for a while, so they're just getting back computers now. So I've been on paper, but I wasn't on paper starting out. I was in the nursing home. So the nursing home has computers. So they have a tablet. So when you're doing your work, you're just punching the keywords and things like that. And then let me show you that. Okay, here's one right here. Sorry for the noise on my thing. So they had a thing, a nurse went around and she gave us these. These are called stylists. So we were able to use it. I have got quite a few. We was able to use the stylus and touch the tablet and be able to do our work without us touching the tablet all the time with our finger. So that was very helpful and sanitary. So I ended up writing down that you would need a temperature. A temperature. I got the one, the like the gun that you just hold up to your forehead and take your temperature. Right, you just press the button and just take your temperature. And I'm getting that off Amazon. The blood pressure cuff I ended up getting off Amazon. I also use the manual one where you just slip it on and you have to literally you clip it and you have to literally pump it. You have to pump the pressure up and then let it go and read it, but you have to have a watch on and things like that. For respirations, you have to have a watch on to check the patient's respirations. But then the blood pressure pump, it'll pump and let you know what the blood pressure is. If you all want me to do a video on how you to use a blood pressure pump, let me know and I will do that. Also, too, you can use the manual one. Well, the digital one that I also purchased from Amazon, that's the one you also just put the cuff on, but you just press the button and you just let it go, and it automatically tells you the blood pressure, the heart rate, things like that. You still have to take your respirations and things like that. Also, too, I don't have it in front of me, but I will do another video on that Where you with hospice, we have where we could check the mat. When you can't weigh a patient, you could kind of see their muscle mass, and you just put it around the circumference of the middle of the arm, and you check the arm and just see the sizes. So it's like a tape measure. It's like a tape measure, but it's really small, but it's a tape measure that you just pull out. And with that being said, if it goes to let's say it stop on 9, and then you flip it over like 9 inches or something like that, you flip it over, it might say 19 or something like that. And you'll, what if the patient used to be like 31, now they're down to 19? That patient lost a lot of weight. That patient used to have muscle mass, now they've lost a lot of muscle mass. That's basically all that means. Another thing is, like I said, pencils, pens, um, blood pressure cuff, the temp, the temp. What else did I have? Let me see. I did have a notepad, even though I was in. Let me tell you, I did have a notepad because when I worked in nursing home and even with hospice, I still write down. Well, we have notes that we write down the blood pressures, but it's a form that we have with hospice. But for the nursing home, it's no form. I still, as I go and pass out my medications, I write down all my blood pressure medicines. I don't care who I told to go get a blood pressure, or who told me what the blood pressure was the last time they checked it. I go check my own. I need to know what my patient is doing right now, what their body is doing right now, and that's how I get through. Because when I go back to the big computer after leaving the tablet, I have to go chart on the big computer. So when I chart, it's going to ask me what was their blood pressure at this time of visit and things like that. And especially if something happened to the patient, what are their vital signs? So always remember to write down the patient's vital signs, okay? It is very important to know how to take vitals. Very important. If you don't know anything else, you better know how to take vitals, okay? Don't panic. It's not hard. People can help you, because if you can't see if it's not working, don't just assume what you think it is or go about what their regular blood pressure can be, because they could have high blood pressure and it's shot through the roof, and you need to know what to do if it's shot through the roof or if it's dropped extremely. Patients may be on blood pressure medications. The blood pressure medication may be too strong, or they may need a increase in their dose of medications. Okay, so at the end of the day, I just want you to guys to understand, it's not much that you need, but I was excited and I just want to let you guys know what I had. I got me a paper clipboard to put my notes in. I got another one that you also can put your papers inside the clipboard and close it and lock it, and it's also like a little keyboard, like a little clamp thing on the front, where you can just slide your paper on the top and write right there, right on top. That was the things that I started out with. Nursing scissors. I also keep those in a plastic bag. They're clean and sterilized. I also keep hand sanitizer. It's a must, because we as nurses always consistently wash our hands. But sometimes we might not be able to. We could just be sitting there just talking to someone and may have just touched their shoulder. You want to always just continue to keep your hands clean, and then as soon as you can get to some soap and water, wash your hands immediately. Always remember to wash your hands entering and exiting a patient's room, okay? Anytime you want to perform anything, anytime you prep food, whatever it is you feel that you're doing for a patient, always continue to constantly keep washing your hands. um, I'm not here to just school you on those things, but hey, you need to know. um the supplies again. Let me see what else. After a while, this is what I want you guys to know. If you, like me, a hospice nurse, or whatever kind of nurse you are, whatever facility that you're working for, a hospital, whatever, and you're carrying a bag, because I've carried so many bags throughout my years that sometimes it'll start hurting your shoulder. So I can suggest to you, when you start feeling any little thing or whatever, just get a bag that got rollers on it. They could be frustrating because when you're pulling them, they flip and flop and things like that. But at the end of the day, try to take some pressure off your shoulders. We do not want us to have pain going to work ourselves. Okay, I want you to make sure that you are at your best to be able to do your best when you're on your job. So maybe that's just for me a long time coming with carrying bags, because like I said, I was a CNA before, and I used to have all kind of shampoos and lotions and all kind of things in my bag. Now with me being a nurse, I have documentations, I have a computer now, but it's a little laptop. It made my bag a little bit more heavier. So what I did do, I changed my bag. So I keep all my extra papers and all these things I kept it in the bag that I already had, right? So I ended up getting another bag. And when I'm going in a patient's home or the nursing facility, wherever my work lets me, tell me what to do that day, my assignment is for that day, I only use in my bag the things that I need, like my blood pressure cuff, my temp, my Mac reader, my scissors. Well, if I know I'm doing wound care, so I'm automatically know I need to do wound care, I'll take the other bag because I have other supplies like ABDs, things like that. But at the end of the day, if I'm just going in as a routine visit and I'm just going in, I will only just take my pad, notes, like all the simple things I need to do to just do vitals and everything I need to do to just write down my visits for that patient. Now, if it comes to be an emergency, the facility can offer things and assist me with my patient, but if I anything else I need, I can also go back because I keep it in my car if it's something like that. But I if it's an emergency, a situation happen when I'm there, the facility can also provide things really quickly for me to have, because that's not something I went in for, but I know that it can happen. Things can happen while you're there. But I'm always prepared. Just the point, I can't just go in and do things either. Things have to be ordered. Everything has to be ordered. I just can't go in there and just say, let me put some ointment on this patient's wound. No, that's not how that's, no. Everything is an order, okay? You have to call a doctor. You have to do all these things and have orders written up for these things. You have to measure the wound. You have to measure the size. You have to, it's quite a bit of things you have to do, but it's not overwhelming. It's just that I want you to do things the right way, because if anything happens to that patient, you just decide to say, okay, well, she got some redness right there, let me put some Vaseline on it. No, we have to ask, because anything is an order. Trust me. You'll be like, oh my God, Vaseline? It's just Vaseline. No, honey, because you don't know what that person is allergic to, what they can and cannot have. So you just can't do anything. I understand you want to protect the patient, and that's what we're going to do. But you can clean it and pet it dry as much as possible. Clean it and pet it dry as much as possible, and then just talk it over, and we can get an order immediately. And if the facility has their particular thing in stock or something like that, but we can get an order and bring it right to them. But we can let the nursing home or the facility, the hospital, anybody like that know, just put a dry dressing on it. Or we could say we put a dry dressing on it, and that way we covered ourselves, that we did something and we didn't leave it. We did not take care of the patient, that we literally took care of the patient. We saw something, we reported it, and we did something about it. We didn't just leave the patient. And we also made sure that the patient did not have any pain. If it was painful, we also reported any pain. And pain is always what the patient said it is. I don't care. You have to look for cues. This is another video. It's a whole nother video. I'm sorry, but you also have to look for pain. You have to also look for non-verbal pain. cues in a patient. If they grunt and moan and things like that, that patient may possibly be in pain, or it could be as simple as repositioning the patient. Okay, I know I got off topic, and that's why I try to write things down and stick to it. But my nursing career just takes over. Okay, so anyway, I just want to let you guys know, if you're working on a computer, you can use a stylus. That way you don't have to always be touching your fingers with everything. Always have gloves. Always have gloves available. That's not nothing that I ordered because my job did provide those things. I'm talking about just the basic things, like things for I can be able to take vitals for my patients, and a pad for me to keep up with all my patients' blood pressures, weights, and things like that. That way, when I do go report to the doctor of my job, because we have meetings every week and we report back about our patients each week, I'm able to explain to my doctor that the patient has lost weight considerably, and we need to come up with a plan, and we'll start a care plan about this patient's not eating anymore, alternatives on what to drink, or keep the patient in BO and DC all medications, things like that. So get to the bottom of the root of the problem, not just throw a band-aid on something and just say we'll see what happens. That's not what we do. So at the end of the day, I just want you to make sure that you're safely going to work. Also too, your bag is your uniform, your supplies is your uniform. Your ID is your uniform. Your uniform is your uniform. If you do not have those things, you're out of uniform. You're not ready. You're not prepared. When you show up at work, you need to show up at work. You need to show them that you're ready to work. You're prepared to work, and they see it. And people could have been there 20 some years. You come in there doing a better job than them. And people do get intimidated about things or whatever, but they've gotten used to things their way, and you know the right way because you just got out of school and you know the book. But the book, let me tell you, it's a real world in the book. Is no room for mistakes. It's everything you have. You have all your supplies when it comes down to NCLEX. In the real world, that's not real. It's not true. You're gonna have shortages. You're gonna be short on towels. You're gonna be short on supplies. Something didn't come in and you ordered it last week. Trust me, you gotta improvise. You have to improvise. I'm just here to keep it real with you. But just get past the NCLEX. Get past the NCLEX and you'll work your way through when you come out here and you see it in the real world. But do not let anybody come in the real world and condemn you and make you do shortcuts. You do it the right way and how it's supposed to be done, and the right way. Try to find somebody who knows what they're talking about. Try to be orientated by someone who's doing it the right way and been doing it the right way for years, okay? Because you have some lazy nurses. I'm just keeping it real. I'm just keeping it real. They've been there, and you can't tell them nothing, okay? But when you start out, you're going to have some nurses that's not going to want to help you. They're going to feel like you're in their way. Look, and I know y'all saw that in school. I know y'all saw it in school. Raise your hand, put a purple heart or anything. Let me know you seen that in school. Those nurses did not want you on their carts because you're in their way and you're slowing them down, which you're there to help them, okay? You're not slowing them down. You're helping them, okay? It's on them that they behind. Why are they behind? Why are you behind? You have a schedule to pass out medications. But don't get me wrong. You can't get behind due to the point of, I said this video was about supplies, and I'll tell you, I'll just be going on. So I'm going to say this, though. This is going to be a whole nother video series, okay? But I just wanted to let y'all know, like, for real, you do have people that you do have situations where you had to stop doing your work due to admit came in, or a phone call came in for an admit, or a phone call came, or you got to put a phone call out because you got to discharge somebody, or you got to send somebody to the hospital, or the pharmacy came, or the lab tech came. You got to give orders, you got to check orders, you got to sign off on things. That can't happen. You can't get busy, and you have to go back. And then if your facility does not have a wound nurse, you have to be that wound nurse. So now you need to schedule yourself. Every day, this is what I did. I went in knowing that I was going to be the wound nurse for that day, because I knew if they told me, and I had to schedule my schedule in the middle of, okay, what, this is my list, who all have wounds on my list. And if I'm working that set all the time, I know who has wounds on my side, on my list, and my patients that have wounds. So I will come in and say, okay, around 11 o'clock, I know that I'm not going to be taking no lunch. I'm going to use that time. I'll take a lunch later. I'll use that time, or it'll be like 10 o'clock ish or something like that, depending on how the day goes. But about 10:30 ish, because I have some patients that want their wounds done and wants to get out of bed. So at the end of the day, I'll take care of their wounds and go and then finish my work. But majority of my morning meals are already passed. And then I can take my lunch after that. So you have to organize yourself, okay? But then if they tell me, oh, the wound nurse is here, you don't have to worry, they're in the building. I'm like, yes, they're in the building. So now I can say, I can go take my lunch at my regular time that I should, and I'll finish my work on time as I should, and then I'll be ready for the next batch of passing medications, okay? I no longer do that anymore. I'm not in the nursing facility. I do hospice care, so I actually go take care of patients that I don't want you to get misconstrued when it comes down to hospice, and that's another video I will talk about. But at the end of the day, I just take care of patients that in their end of life stages. But everybody's not in their end of life stages. That's why I tell you I will give you another video about that if you want to know anything more about hospice. Because um, I did a video about hospice for my um, public speaking class, and I got an A because I actually told people and educated people about hospice, and not that it was just not about you have 6 months less to live. It was more than that. And a lot of people came back because our other students, the students, had to come back in and we had to listen to everybody's video and critique it. So they came back and they was really like, oh my God, I see hospice differently now. And people didn't know that because you panic as soon as you hear the word hospice, and most people do. But at the end, but you do have to have a compassionate heart and just love what you're doing, okay? So I want to end this video and let you guys know that's exactly what I had. Pretty much repeat: a bag to put your things in, a stethoscope, a temperature reader, a blood pressure cuff, a stethoscope, scissors, a notebook pad, a clipboard pad, pens and pencils, erasers, pen and pencils, and pencil erasers. That way, if you want to write something and you want to erase, but only on your pad, because a legal document you cannot. Please have black pens. Black pens are legal, and have multiple pens on you. That way, when you're writing and the pen runs out of ink, you're prepared to just go right back in your bag and grab another ink pen. Always remember washing your hands. I'm looking down trying to see if I remember anything else, and thinking about what's in my bag as well. So yeah, so I ended up switching up bags and things like that. I ended up having a bag that had the handle that you just carry like this. But like I said, when I worked at the nursing home, I had a book bag, so I always just held it on me. But with the in the nursing home, the book bag, I always was able to go take it and put it right into, lock it up in the medical room. But with hospice, everything is in my car, and I carry it to each patient house. But when I go to each person's house, that's another thing too. Hospice teaches us to have newspapers, so I have newspaper in my car that when I go to someone's home, I place newspaper down and I put my bag on top of the newspaper. That's protecting my bag and also other people's properties as well. But for me, also, I also carry microband. I don't know if you know anything about microband, but microband is sold at Menards or Home Depot or wherever you can find those local places at. And it's just like Lysol, or you can carry Lysol, but I like microband because microband lasts for 24 hours. So anything that's been touched will not have germs. So I spray my clothes, I spray my bag, I spray every time I leave out of a patient house and also before I enter a patient house. And by the time I walk to their door, anything that touches me is not going to, I'm not going to take anything or bring anything back. But also too, consistently washing my hands and everything I'm touching during the time. I'm also having like a little bitty bottle of hand sanitizer all during my visit. So I just want to let you guys know that. Hope this video helped anyone if you was confused about what you're gonna need in the world. But if you don't want to get anything because you're going into a nursing home, that's on you as well. But sometimes when you're in a nursing home, the cart for the blood pressure pump might be way down the hallway. And if you have your own stuff with your own name on it, because I put my name on my things and I had it on my cart. I always clean my cart. I sanitize my cart. I don't care who had cleaned it. I cleaned it again. I cleaned my own station entirely every time I came to work because multiple nurses and multiple people are touching the carts and things like that. I wipe down every single thing, every drawer, every handle, every single thing because I'm not taking home anything and I don't want to bring home anything to my family as well because I do spend time with my grandchildren and I love them and they love me and we all want to stay safe as well. So with that being said, I love you all. If there's anything else I can think of, I will come back and do another video. Love you all. See you on the next video. Don't forget to like, comment, and subscribe. And also continue to keep on checking out my Beacon store where I offer so many reviews, books, planners. I've worked very hard to help you all achieve your goal in passing NCLEX. I've done all this work for you and I'm going to continue to keep doing it. I love you all. And until the next video, love you guys. Thank you so much. I'm here for you, okay? I'm here for you. Just always remember to reach out. I'm here all the time. Just reach out to me. I'll answer any questions if I can. If I don't have the answer, I will find the answer, okay? Have a blessed day and good night.